People with disabilities are 6 times more likely to die from COVID-19 than those without disabilities. And people with disabilities experience other health disparities, including higher rates of diabetes, stroke, heart disease, cancer, and depression. And we know these disparities existed long before COVID, and they will persist if we don't do something about them now. The Michigan Developmental Disabilities Institute, or MI-DDI, is the federally designated University Center of Excellence on Developmental Disabilities, or UCED, for the state of Michigan. And every state and U.S. territory has a UCED, and we make up a national network of 67 UCEDs. UCEDs serve as the bridge between the ivory tower of academia and the community, and we do that through training, community supports and services, research, and information dissemination. And our vision is healthy communities for all. And the way that we're going about this is we've created criteria to become a most valuable provider, or MVP certified. And this means that a site is accessible, sensory-friendly, and welcoming to all people, including those with disabilities. Currently, we have 14 MVP certified sites across our state. We started with our champion, the Wayne Health Mobile Unit, who's been working with us and been MVP since the beginning.
As the first to become MVP certified, we really wanted to incorporate the ability to reach all patients. And so working with Sharon and MVP, we were able to revisit our current vans. We had 7 at the time, and really reimagine how those vans could be made fully accessible to all members of the community. But along the way, we always wanted to know what were people's challenges from a disability perspective and how we could address and help meet those challenges. So early on, we started asking about social determinants, things like food insecurity, housing insecurity, utilities. We even incorporated questions around voting assistance and legal needs, so that not only could we understand what the person coming to us needed, but we could also relay to funders and others involved in this ecosystem the need for addressing this specific population.
I first encountered the Wayne Health Mobile Unit at a community event. I got one of my COVID vaccines there. But to have that mobile unit there with the ramp deployed, available for seniors and individuals with disabilities, to know that they had a safe space with individuals that were concerned about their well-being. They felt like they belonged there because there was access created for them. So that's a beautiful thing.
People with disabilities have the fundamental right for the highest standard of health. And we're working toward this, continuing to develop and deliver training for healthcare professionals, to include disability as part of diversity, equity, and inclusion initiatives. And then finally, we cannot show how we are addressing reducing disparities if we don't have good baseline data on disability. So we are asking that disability status be consistently and systematically collected across sites.
Adults with disabilities are over 25% of the population in the U.S. It's too large of a demographic to continue overlooking, and there is not enough focus on this population when healthcare providers go through medical school. There also needs to be a more holistic approach to medicine and to healthcare. People with disabilities often feel like they're not seen as a whole person when they're receiving health care, because the tendency is to look at the immediate medical need. And we need to start counting disability through the data that we gather. When we don't count disability, we miss a huge part of the problem in non-disability specific issues, such as health equity.
So we have over 40 staff at Detroit Health Department who are MVP trained on how we could better provide services and safe quality care to the population. So the sensory treatment room has been a very positive experience. Here at Detroit Health Department, it has provided us an opportunity to interact with the clients that have disabilities where they can feel comfortable and safe in our care.
The Autism Alliance of Michigan really emphasizes anything that's going to help blunt some of the sensory stimulus coming in. So having covers on the light fixtures is one thing. Looking at sound, using noise canceling headsets, or things like having available a chew toy or a pull toy for a child to interact with. So we really focus on paying attention to those sensory inputs. Smell is another one. You don't want strong cleaning products or staff coming in with a lot of perfume.
Having an environment that's warm, that's friendly, that's very patient and understanding to meet the needs of the clients, it's been very, very positive. I would highly encourage any and all other health departments in Michigan or throughout the country to go ahead and participate in a wonderful program like MVP.
We want to expand MVP certification across the state, getting all 45 local health departments MVP certified, as well as many healthcare systems as we can. And I see this as the beginning of a journey. We have a long way to go. This is the time to really forge partnerships and alliances to promote disability inclusion. And in part of that journey, please, I encourage you, get to know your USED in your state or territory. We are here to work with you and to be that bridge between academia and the community.